Hi, I'm Ranjika here, a transgender woman working in a corporate sector, being as a social activist for more than 15 years. The first and foremost it is the doctors has to have an analyzations and they should have aware of all the sexual identity as well as the gender identity. Because any patient as me as a trans woman going to the doctor and want to have any kind of therapy or a checkup or any kind of health issues to examine my body, I have a lot of inferiority complex within me to getting into the doctors. As a getting, if a doctor could not examine me properly and psychologically cannot treat me as a human being or cannot have a proper knowledge about ourselves, it will be very difficult to get the proper medicine facilities as well as to find out the right doctors for the ever service for our routine health. So this is the one point that I really want to say to the medical practitioners as well as the medical team and to the Indian Medical Council also. Let them add a curriculum about the trans community people so that it becomes very easy for them to understand about the trans community people and make them to give a good facilities as well as to treat them as very equality. Nowadays, wherever the clinics are there, it's only one thing, they have to have a friendly relationship. They should cope up with the trans community people or the LGBT community in a very friendly manner because most of them come from a very insecure mindset whether the doctors can give a good health checkup or any kind of good thoughts. But these thoughts will even affect the trans community people as well as the doctors. I want to make a very clear statement that any trans community people or anything, that the doctor should not have a more empathy or a sympathy towards the trans community people because here we talk about the humanity. What is humanity? Humanity states about the equality. So the equality means there should be no kind of no gender biases. Any men or any women or any trans community people or transgender people, everyone should be treated very equally when access of the medical facilities because here we will know that today if that equality or that kind of gender thought doesn't happen to the non-community people, if they don't have that thought process, we will able to understand that they have a very specific, we have a sympathy. So it even gives a bifurcation between the community and the non-community people. That has to be changed because even we also feel that we are the part of this country and we are living in the democratic country. What is democratic talks? Equality. So there should be easy equality. There should be no kind of a gender phobia and they should not have more of empathy towards the trans community people. Rather give them an equal kind of treatment, access the equal kind of treatments and even the facilities also.